Assalamu alaikum everyone. Today I will demonstrate you a typical lumbar vertebra. So first to fourth lumbar vertebra are the typical lumbar vertebra. Typical lumbar vertebra possesses mammillary process, a slight elevation on the superior articular process of the vertebral arch. So you hold it in this position, in anatomical position. The vertebral body lies anteriorly, vertebral arch lies posteriorly, small spinous process lies backwards and horizontal in place. Vertebral body is almost reniform in shape, kidney shaped. Anteroposterior diameter is smaller than the transverse diameter. The vertebral foramen is triangular in shape. The vertebral arch is connected with the vertebral body by a thick pedicle. The transverse processes lies posterolaterally is connected with the spinous process by lamina. Superior articular process having superior articular process posteromedially. Inferior articular process having inferior articular facet anterolaterally. The pedicle has superior vertebral notch and inferior vertebral notch. The elevation from the superior articular process is known as the mammillary process. The spinous process is broad, thick, and horizontally placed. It is short. The attachments. The anterior longitudinal ligament is attached to the anterior surface of the vertebral body. Posterior longitudinal ligament is attached to the posterior surface of the vertebral body. Ligamentum flavum is attached to the anterior aspect of the lamina. Supraspinous ligament and infraspinous ligament are attached to the corresponding superior and inferior lumbar vertebra. The muscle attachments are first, second, and third lumbar vertebra. In the right side, they possess the right crus of the diaphragm in the anterior surface. And in the left side, first and second lumbar vertebra possess the left crus of diaphragm in anterior aspect of left side. There is an attachment in the lateral aspect of the vertebral body, the psoas major muscle. The pedicle shows an anterior arch. The anterior arch gives attachment to the anterior layer of thoracolumbar fascia. The tip of the transverse process is attached to the middle layer of thoracolumbar fascia. The spinous process is attached to the posterior layer of thoracolumbar fascia. In between anterior layer and middle layer of thoracolumbar fascia, there is quadratus lumborum muscle. In between middle and posterior layer of thoracolumbar fascia, there is erector spinae muscle. In deep of it, there is multifidus muscle. The multifidus muscle is attached to the mammillary process of superior articular process. The vertebral foramen passes meninges of spinal cord and its spinal cord at the lumbar 1 vertebral foramen. After lumbar 1 vertebral foramen, it will pass phylum terminally, a condensation of pyometer, chorda equina, horsetail like spinal nerves of corresponding lumbar vertebrae, and conus medullaris, the tapering part of spinal cord. That's all. Thank you.